I'll ask the live stream started, please.
I can confirm, as Chairman, the live stream has now been started.
Right, welcome to this meeting of the Health and Wellbeing Board held on Thursday, the 27th of April. I'll ask John Coleman, just to explain a little bit about how we're going to run this meeting.
We have both the Chair and the Vice Chair who are absent from the meeting. So our Constitution makes provision that the meeting itself can create a chairman just for this meeting. So we will just need somebody to propose a chairperson and then second it, and then the meeting can commence under that chairperson.
Propose. Second.
Lovely. Councillor, you are now chair.
Okay, thank you very much. So for those present in the room, if the fire alarm sounds, please leave the building by the nearest exit and proceed to the assembly area in the car park. The agenda papers and other relevant information for this meeting are available for public viewing on the Herefordshire Council website. The Council is streaming this meeting live on the YouTube channel and is making a recording. To ensure that recording quality is maintained, please speak as clearly as possible and keep background noise to a minimum. Please ensure that mobile phones and other devices are turned to silent. Others are permitted to film, photograph and record our public meetings, provided it does not disrupt the business of the meeting. If there are any members of the public present who I can't see, if they do not wish to be filmed, they should indicate. Voting will be undertaken by a show of hands for those in the room. Only committee members present may vote. We have a number of people in attendance as virtual participants. Can I request they use the raise hand function within the system if they wish to contribute to the meeting? Members of the board, chairperson is Maureen Crockett, who is absent, as is Vice Chair Jane Ives. I will move then to item 1, which is apologies for absence. I guess apologies have been received from a number of people. Do you have?
Yeah, we've had apologies for absence from Jane Ives. We didn't have apologies for absence in time for the meeting from Councillor Crockett, but I think we will table those as apologies.
I forwarded apologies for Simon Trickett as well this morning to Henry.
Thank you. Yeah, Simon Trickett as well.
And apologies from Dr. Mike Holm, so I'm representing his place.
Thank you. Good, thank you very much. So we've got the name substitutes then, I think, from what's just been mentioned. Any declarations of interest? Do any members wish to declare any Schedule 1, Schedule 2 or other interest in any agenda item? No, I see none, thank you. Minutes, passing into the minutes of the meeting held on the 13th of March. The minutes are included in the agenda. And if I may, I'll move to accept those minutes. Does anybody have any comments in particular? I think we're supposed to have them before the meeting. So, so if I move to accept the minutes, all in favour, which is really only those people who are present at the time. How many people we've got present the last time? Thank you. Any against? And any abstentions? Thank you. Questions from members of the public? None have been received for this meeting. The same with questions from councillors, none have been received. So we move on then to item 7, which is the first substantive item here. It's the annual report from the Director of Public Health. Matt, over to you for this report. Thank you.
Yeah, thank you, Chair. So just a bit of context. The Director of Public Health annual report is a statutory duty that each Director of Public Health has to produce an annual report every year. So I'm pleased to say this is my first one for Herefordshire, for which I decided to focus on healthy and sustainable food. Really, the idea of annual public reports is to highlight the key challenges facing our county on a specific area or topic of interest, and recommendations for actions that individuals, local authorities, institutions and other organisations might want to consider as part of the report. I'm just going to take us through the presentation, which I believe was sent out with the papers to talk through. Happy to stop and take any questions as I go through that. Those that might not be able to see the screen, I'll tell you which slide I'm on. So I'm on the second slide. So really, why is healthy and sustainable food important? Well, we know food is really important. We know that it forms a central part of our life in terms of how we spend time with family, how we spend time with friends. But we also know that actually food has a big impact not only on our health, but also the environment, our social and economy too. But we know that actually the high-tech nature of farming systems has led us to become increasingly distanced from agriculture and consequently the story behind our food. So many people don't really know where food has come from, how it's been transported, where it's been grown. But it's also a really complex issue. We talk about that here a lot at the board in terms of complex issues, and there's not one single factor in terms of what influences our food system. There's many different factors, and it's often described as an interconnected system of everything and everybody that influences and is influenced by activities involved in bringing food from farm to fork, something you might have heard before. One of the things I really want to do as part of this report is actually celebrate all the great things that are going on in Herefordshire, and I hope you find that comes through quite strongly, because I think we need to be proud of all the great work that is going on around healthy and sustainable food, and there's some examples of best practice throughout the report. And I won't go through all of those today, but I did want to make that acknowledgement. But yes, there are challenges, but actually there's some really good things we can build on. One of the good things in Herefordshire is the Food Alliance that's been in existence in 2020. So this is a partnership of voluntary sector, community sector, statutory sector, private sector, all coming together to look at healthy and sustainable food. And it's a really good footing in terms of how we can go forward and drive this agenda together. And there's many of the recommendations outlined in this report that I suspect they'll be really interested in taking forward collectively. In terms of food and health, as I said, poor diet is one of the leading risk factors for driving the UK's high burden of preventable ill health and premature death, and can contribute towards widening inequalities. But we also know food and diets associated with developing chronic diseases, so cancer, type 2 diabetes, heart disease and stroke. And we know that red and processed meats and sugar can contribute towards those risks. But we also know from the data that cancer and diseases of the circulatory system are leading causes of premature death in Herefordshire. They account for 3/5 of all deaths before the age of 75. So a really key risk factor in terms of living a healthy life. We've talked about at this board before about the prevalence of child and adult obesity. So in Herefordshire, we are above the national average for child obesity, particularly those aged 4 to 5 and adults too. And we also know that the poor diet's a risk factor for type 2 diabetes. And again, at the board, we've also talked about oral health. So we know that sugary foods and drinks can contribute to poor oral health, and that's another area where we know we don't do particularly well. And I think it's important to recognise that these all have an impact on the public sector services, so social care, health. We know that poor diet can contribute to the impact and demand on some of those services, so it's a really key preventable thing that we can do to change. So on to the third slide, which is food and the environment. So we know that the global food system is recognised as the single biggest contributor to biodiversity loss, deforestation, drought, freshwater pollution, and the collapse of aquatic wildlife. So often food is associated with the impact on health. As I said, the environmental impact is huge as well, and we know that if we have a healthy environment, that can pay dividends to our health and well-being too. And it's also one of the biggest causes of climate change, responsible for 25 to 30% of global greenhouse gases, which are only second to the energy industry, so a really significant impact. We know that a shift to plant-based diet, sustainable, seasonal, local source food, and a reduction of food waste can also reduce carbon emissions. So there's win-wins from adopting healthy and sustainable food systems. We also know that farming is an essential part in Herefordshire. We know there's lots of food produced locally, and that's something we should really build on. There's also a point around food waste, and we know that in this country it's still a significant issue, and that more than a third of black bin rubbish is food waste and its packaging. And in 2022 in Herefordshire, we found that 70% of food thrown away was considered avoidable. And I know there's lots of good work going on around the sustainability agenda to address that. Of importance to the board too is around food insecurity. So we know that multiple factors affect national food insecurity, and we've seen that most recently with the war in Ukraine and how that affects global food systems in terms of grain and that can lead to disruption in food prices. And also recently we've experienced a cost of living crisis where it's been really challenging for people who want to live and lead healthy lives. Eating healthy food is more challenging. We know that the poorest fifth of UK householders would need to spend 43% of their disposable income on food to meet the cost of the government's recommended healthy diet. So as I said, it could be a key driver to health inequalities. We also know that healthy foods can be more expensive, up to 3 times more as expensive per calorie as less healthy foods. So that's also something we need to consider. Most notably in Herefordshire, we've seen a 100% increase in the use of food banks over the last 12 months, again, reflecting on the impact that the cost of food has had on our residents. In terms of food quality and choices, so there's lots of opportunities throughout the life course to lead healthy lives and eat healthy food. We know that breastfeeding and weaning are fundamental parts of a child's upbringing and can develop behaviours going on and bring benefits too. We know that in some of the studies we've done and surveys, we found that children are more likely to report having had nothing to eat or drink for breakfast, more chips or roast potatoes on most days, and less fresh fruit on most days, and more recent sugary drinks. So again, there's work to be done to support the eating habits of our young children. And we know that preschool meals are really important, particularly those on low income or experiencing poverty. There's some really great work going on in terms of school food standards. So we're doing some work in schools about how we can raise the quality of food being delivered in our schools, and that's really important. And it's something that the board might want to consider going forward as to how we build on that and support our schools to create those healthy settings. And there's also things that people might experience as they age as well, in terms of their difficulty in managing a healthy diet through physical conditions such as arthritis, mobility, and the ability to cook meals. And then finally, there's a Healthy Start programme, which has been around for many years now. So that provides fruit, vegetables, milk for women who are pregnant and for children up to the age of 4 who are eligible. And at the moment, 61% of families eligible receive those benefits in Herefordshire, meaning 40% don't, and that's around £154,000 of unclaimed vouchers. So really important we try and increase that uptake and maximise that. The food environment, something really close to my heart, and again we've talked about this a lot, is actually the environment around us and how it influences our behaviour, the conditions that we're born, live and work and grow in, and they do exert a powerful influence on our diets, and that's often really difficult for us to change at a local level. We refer to these as the commercial influences on health, and they shouldn't be underestimated. Powerful forces through marketing and a range of other tools often influence our choices and how we buy and purchase food. So certainly something to think about when we look at marketing to children as well, and there's lots of national work going on around that. In terms of 5-a-day, Herefordshire does quite well, 62.7% in Herefordshire, but that still means that 38% aren't achieving their 5-a-day. And again, that's just one metric we can use to look at that. The other thing that I'm quite interested in is product placement. And you would have heard of this before in terms of supermarkets and other retailers and how they actually place unhealthy foods at certain parts of their retail environments, most likely at the checkouts and things like that. There could be opportunities locally about how we influence that and the behaviours. And some of you might have come across the nudge theory. That is one example of how we might want to do that. But again, there are opportunities there about how we can influence dietary behaviours and purchasing behaviours. On the food economy slide, again, we know that Herefordshire has high employment rates in the food sector, which may well contribute to a high number of households in fuel and food poverty due to low wages generally experienced by these individuals. But we know that the food manufacturing and processing sector's high employment concentration in Hereford is almost 4 times as concentrated as the national average, and accounted for 43% of all employment for this sector in the Marches area. And despite the importance of the food system, its workers are poorly compensated, with 22% only earning the national minimum wage or below, compared to 8% of all workers, and nearly half reporting food insecurity. And it's important to note, as we often do in this board, the interface with the big economic plan and economic prosperity, and there's obviously lots of good work going on within that plan in terms of some of the aims and objectives they want to do in terms of transforming land management, amongst other things. So on to the case studies towards the end of my presentation. So again, I didn't want to go through in all the massive amounts of detail, but some great things from Soil from the City, from Peddy Cargo, for example, collect trade food waste by bike, There's a Ross Community Garden that was established in 2013, where their school education visits take place. There's a kids' kitchen. They provide food activities for families in Herefordshire, but they have fun, they cook from scratch, use local food. The Cart Shed, another example, supports adults and young people experiencing mental health difficulties, and some of that is supported through growing food and horticulture. And then the Sheds Together cookery programme that brings together people together to cook, eat and socialise. So just a few of the examples that actually we can build on as a board. So the final slide is around the recommendations, and these are my recommendations as part of the report that the board might wish to consider. Again, many of these are primarily at the local level. We know much of the determinants of factors at the national level, but there is that importance of continuing to work in partnership. As I said, it's a complex system, so therefore we have to work together on that. Number 2 is around an opportunity for good food education. So again, there's already lots going on in schools, but actually we probably need to do more, including supporting those children with packed lunches and parents and education. And there should be supporting healthy food for all. So again, how can we support families to cook from scratch? Utilising the food that we grow here in Herefordshire, so actually the transport miles aren't as far here as compared to other parts of the country. And we're doing some good work around local food procurement. So actually, when we procure our contracts, how can we actually source local food? And I know there's some good work going on the marches about what models we could do to do that. And again, we've got some big public sector organisations sat around the table here. So actually, how can we look at our own procurement contracts in terms of how we're actually procuring food and making sure that's healthy and local. And so consider the effect of the food on the environment. As I said before, most people know about food and health, but actually do they really understand the impact it has on the environment, and educating more people around that when they make their food choices. And then finally creating those conditions, so thinking about workplaces, thinking about a local food award scheme perhaps, so we can encourage local retailers about how they source local food, but also how they cook food and deliver food. And then the final one is around play your part. So the very last slide is around how we can all play our part as individuals. So it's just some recommendations, and I hope each members of the board could go away and have a look at this checklist this afternoon and this evening, and also promote within their organisations, again, some of the simple things we can do that all add up, that make an overall difference, whether that's for signing up for Herefordshire's Food Charter, which is a really good initiative, whether it's about reducing our meat intake, even only slightly can make a big difference, as well as looking at the amount of waste and food that we get rid of. So I'll conclude there. I hope that provides a useful summary to the board. Happy to take any questions.
Thank you very much, Matt. I think I'm inspired to go and dig my vegetable patch this afternoon, actually. I have started, I have to say it. It's a matter of getting the courgette seeds in and that kind of thing, but that's part of it, isn't it? It's growing locally. Okay, so the report is a sort of catch up on what you've been doing over the last year, but I think we can have a general discussion about that. But you're particularly interested, I think, in the recommendations you've made and any discussions and comments, maybe any additional recommendations, which will then perhaps help with your work over the next year. So I'll do my very best to catch anybody who's remote, if they'd use the usual hands mechanism or whatever, but we'll start off with any questions or comments in the room. Diana.
Yeah, thanks, Matt, and it all looks very pretty as well. So, thank you. Yeah, I think it's really useful to have a lot of us go to quite a lot of meetings where we're all talking about everybody doing it feels as though we're talking about everybody doing everything all the time. So it's really nice to have a focus, and we've even got this organisation, Herefordshire Food Alliance, which can be a sort of focal point of action in the food charter. So I think it's really useful and nice that we can have a focus on that. And I think Herefordshire can be a leader, as you've said. We really can be a leader here in this kind of thing. Obviously, I'm interested particularly in what's going on in schools. We can be a leader in the food standards in schools. And I see a lot of really good stuff going on in primary schools about healthy eating, and not so much in secondary schools. So, but let's not forget about that. It's much harder to do it in secondaries, but let's not forget about them. And also, as you say, the uptake, ensuring that families do take up what they're entitled to. We know that Talk Community is a useful vehicle for that. And, the parish councils, let's make sure that Talk Community is working with the parish councils not just, we sometimes hear about the market towns and these things, but there's also all the parish councils who I think sometimes, like to be reminded of, something really practical they can do, which is remind their residents of what they're entitled to. Thank you.
David?
Yeah, Matt, as you can imagine, I was fairly interested in section 2 and the links to population to health. So we have about 1.2% of the UK population that lives in Herefordshire. And when we look at that kind of 1.2% of £6.5 billion, my maths might be dodgy, is about £76 million we incur for people with diabetes in the health system. It's a big number, isn't it?
Yeah.
When you say it like that. I was wondering, because we've got 31% of our adult population who are obese compared to a national average of 25, do we know what that kind of 76 million might be if we could get up to a position where we were, average? It would be a very interesting calculation to have to give a sense of the size of the prize for us to go after by really getting this right.
Yeah, no, that's a really good question, and we did try and quantify what that impact would be for Herefordshire. It's really difficult. I think the last time some estimates were based on local authority impact of obesity was probably around 2009, 2010, and nothing's been done since. And I do wonder if it's just too difficult because it is just so complex. I think we could probably do some local analysis.
Yeah.
I think, don't you think, in terms of those conditions we know obesity and diabetes contribute to, we could probably do some kind of crude estimates.
Yeah,
so we can kind of quantify that. 'Cause I think it's really important, because I think this is quite distant from the health system, isn't it? And it's very upstream, but actually, like you say, we're looking at prevention. This is where we need to be. This is where we need to start, and trying to quantify that might help.
I think perhaps feeding on that, the health and welfare, the strategy we've got coming up talks about children and mental health being really two really important issues. They're sort of priority. Obesity presumably starts with children, and it starts with them perhaps getting out and having more exercise, more time in the countryside, even having their own plot of land to grow food and that sort of thing. Any other questions in the room? Anything outside? Anybody remote? Hands up. I can't see any. Hands up. Okay. So Matt, we haven't got any sort of concrete proposals or proposed amendments to your recommendations. So I take it as read that we're in favour of all those, and we'll look forward to seeing how that pans out over the next year. So I think I have to ask for a formal vote. So the recommendation is to note the content of the report and for the board members to share with respective organisations and networks to consider the recommendations contained. So I'd ask if you note the contents and ask you share them with respective organisations. All those in favour, show of hands. Thank you. Thank you very much. So we'll move on then to the next item, which is the health and wellbeing strategy, which is kind of what I was talking about, the children and mental health. So Matthew, you again.
It's me again. Yeah. Sorry about that. So firstly, just want to acknowledge Mary Noah's leadership in development of this strategy. So I know we've done a lot of work in this space over the last few months. You'll all recall that we commenced this journey June last year. And the reason for bringing in the strategy here is to get the sign-off from the Health and Wellbeing Board to take that forward. As you know, this is probably the primary and key focus of the Health and Wellbeing Board, is to set that overall vision for our population health, and I'm sure David will talk about the integrated care system in a minute. This is really a fundamental document that I'm really keen that we as a board drive forward collectively as partners, and it is as partners, and we own this together over the next 10 years. So we've done a lot of work on the strategy, and we've kept the board frequently updated on its journey. We shared a draft with the board probably about 5 to 6 weeks ago now, so I'm not going to do a presentation, but what I probably will do is just highlight some of the key changes from the draft that came to the board, and I'll invite Mary to make some comments on it too, and then we're happy to take some questions. So really the the strategy itself, we wanted to tell a story, which I hope that we've done. So we've adopted the same vision as the integrated care strategy, which I think is really important and really welcome, to show that we're all striving to achieve that same direction of travel. Within that strategy, we've talked about the local needs. So there's an infographic on, I'm not quite sure what page it is for you all, but page 10 to 12 is that landscape infographic about what is it like to live in Herefordshire, which sets out some of the key challenges. And we've obviously done that through an investigation of understanding the need through the epidemiology data, but we've also done some engagement, which I'll talk about in a minute, with the public. We've also talked about how we developed the strategy. So the board will recollect we did a really intense engagement activity. Over 1,000 or around 1,000 people commented online for the development of the strategy in the online survey. And we also did 14 hard to reach groups engagement sessions. Again, really powerful, making sure we reached out to those that we really want to support and help. Within the strategy as well, we've just strengthened the type of community in Herefordshire and the type of place we want it to be in 10 years' time. So we've actually elaborated on the 4 ambitions, which are thriving communities, healthy and sustainable places, opportunities for all, and healthy people. And that covers very much similar to what my last DBH report was about. It's about how we strengthen our communities, asset-based approaches, working with communities at the heart. It's about creating those healthy spaces, active travel, infrastructure, housing. It's about opportunities for all in terms of inequalities, social mobility, and also healthy people, to help healthy people enabling to help themselves, look after themselves and each other. So that's the ambitions that we've set. We've kept the same principles that the board agreed. 2 that come out for me is prevention first approach. It's really need to focus on that prevention. And on David's point just now, I think it's how we maybe strengthen those business cases for prevention. I think that's really important. And then also health inequalities. There's a stark infographic we put in the strategy. I think it's on page 18, talking about bus routes, mapping life expectancy on bus routes across the county. So just really illustrates actually the variance in life expectancy across our wards. For men, it can be up to 11 years between some wards, and for women, it's about 6 years. So some real kind of powerful things in terms of, I guess, our moral obligation to address some of those challenges. And within the strategy, we've spruced up, is probably a better word for it, in terms of the plan of page. So it just details our vision, ambition, core priorities, secondary priorities, and how they all fit together. And we try to strike that balance between the board wanting to focus on the 2 priorities, best start in life and mental health throughout lifetime, as well as the supporting priorities that many of those are wider determinants, housing, economy, and those types of things we know are really important to shape our lives. And then finally, we've just added a framework for delivery towards the end of the strategy. So it's a bit of a cycle. Some of you might be familiar with a commissioning cycle, but it kind of talks about actually if we want to go about delivering action and change, there's a clear systematic process we can do. At the heart of that is about involving our communities, co-producing, but it's actually understanding the needs, what's the evidence out there, engaging with our communities to understand the issue more, and working with them to design the intervention, understanding what the impact is for those living in rural communities, and then evaluating that, and then innovating and spreading that change. So that's something we probably need to talk to as a board in terms of the next steps in the action plans that sit beneath this. And then there's also a set of indicators that closely align with the integrated care strategy, which I'm sure David will come on to in a minute, in terms of how do we actually monitor change from some of those outcomes and those priorities that we've identified. So the next step, really, assuming that the board are happy to endorse and sign this off, is to develop those action plans. And within that strategy, we've listed where those partnership groups sit that are accountable for delivery of that. We're recommending that One Herefordshire owns the coordination and oversight of those 2 core priorities. Actually, we know Best Start in Life will be delivered through the Children and Young People Partnership, and then mental health. There are several groups that can support that in terms of the Mental Health Collaborative, Children and Young People Emotional Wellbeing Group, and then also Adult Mental Health Group. That needs a little bit more work, but ultimately we want to delegate those partnerships to now develop those action plans, bring those back to the board in maybe 3 to 4 months' time, and then the board can sign those off. Again, what are those changes we're going to make and what are the outcomes that we want to achieve. Mary, did you want to add anything more than?
I don't think so. I think you've kind of encapsulated it all. I mean, yes, it looks a little bit different to when we came with this last time, but I think essentially we've captured all the issues within the priorities we've got. So it's still best start in life, still good mental well-being as our sort of our two main ones, with these supporting priorities. And we did sort of tease around with these quite a number of weeks, but I think we have, incorporated all the issues that we need to. And like Matt says, I think it's going to be about the action plans when we come to have an event and to bring together all the experts around the table so that we can take forward the implementation.
Yeah, thanks, Mary. I forgot to say that, but you just said that. So what we're looking to do is have a launch event middle of June. So we're just finding some dates for that, so we can actually formally launch the strategy, but also start that conversation on what those actions will look like to deliver those outcomes. So we see that as quite an important milestone going forward. But yeah, I'll just take any questions.
Okay, so any questions, comments from within the room? David?
Thanks, Matt. It's great to see such strong alignment to the whole system integrated care strategy, which obviously makes it a lot more coherent for us all working together, which I think will have greater impact. I've just got one fairly minor observation, but I would just encourage us to think about it. So on the best start to life, you specifically describe kind of 0 to 5 years. And I just wonder whether we should stop at 5 years or whether we should have a broader period, given the longer term impact. Because at 5, essentially, you get into the end of the primary school years, aren't you? And as Councillor Toynbee said just now, the issue in secondary schools around healthy eating, for example, might get missed on that kind of thing. So it was just challenging that 0 to 5 and wondering whether we should go a bit beyond that.
It's a good challenge. I think we discussed that briefly before. I think the intention is to stay up to 5 primarily, because I think that's where we know the differences make, and the evidence is so strong in terms of if we intervene within those 5 years, the longer term outcomes are a lot better. That said, I think we anticipated that the good mental health throughout lifetime will pick up a lot of the other things and the other transition points in schools and other things across the life course. So I think that's probably where we see some of the other ages being tackled. Is that right, Mary?
Yeah, and we've also agree with that, and we've also got you'll see there from the vision diagram supporting people to live and age well, and that means actually helping children to grow into healthy adults, to then grow into healthy mature people, to then grow into healthier old age. So I think under that supporting priority we can hang healthy older children as well into that adulthood.
I think with anything, when you develop these strategies, I think you can almost, they're so interdependent, all these different outcomes and things, and you end up just covering everything and spreading yourself too thinly. So we try to strike that balance between actually focusing on 2 areas. But you're right, David, that's not to say all this other stuff's not important. I think it will probably go on in other kind of areas across the council. I think it's for we as a board, that's what we want to focus on. But I'd welcome comments from the board if they agree or disagree with that.
Any other comments? Anybody on Zoom? Hands raised? I can't see any. Oh yes, there is a hand raised now, I think. Alan?
Thank you. It wasn't really a question. It was more of a statement of support, really, of the work around this. So through the One Herefordshire Partnership, a number of stakeholder organisations have come together to help co-design this work, both looking at the proposals around priorities and the outcome framework as well. And we've committed to include these priorities within the work plan of the One Herefordshire Partnership. So this is connected up to that, and this will form a key part of our priority work over the next year. So we've incorporated that into our work plan going forward.
Matthew, I guess the current topic is about dental health, isn't it? There's lots of BBC coverage on the inability to get hold of an NHS dentist, and that's part of the programme is to improve dental, well, the obvious question is, where are we going to get these dentists to come to this county and provide the necessary services, unless there's another way of doing it. It's just one sort of small issue, but as I say, it's quite current, Matt, isn't it?
Yeah, happy. I mean, I'll get Stephen in a minute and others, but I mean, we've got oral health. It's not particularly around access to services, but oral health will likely remain a priority in terms of best start in life, so in terms of the real upstream prevention stuff. And I know that's been, I think Alan might have challenged it in a meeting. Oral health's been a priority for some time of this board. So actually, why should it still be a priority if we're actually not addressing that issue? But I still think that's really important, and there's good work we can do around that in terms of fluoridation. We've got access to services leader as a supporting priority, because that came out really strongly in the consultation, like you say, whether it's GPs, dentists, and obviously we work with the NHS. David, I suspect that will come through the forward plan in terms of that strategy. So I don't know if you wanted to cover that maybe in response to that.
Yeah, I mean, up until 31st of March this year, NHS England centrally were responsible for commissioning dental services, as you know, and it transferred across to the ICB on the 1st of April from this year. So we now have more local control over the commissioning dental services. But we recognise the massive challenge we've got to try and turn that around. What we have focused on is making sure we get an absolute fair share of the allocation that was spent regionally before, because if you take your allocation based on actual spend, when there's very low provision, then you don't get a fair share allocation. If you get your allocation based on need, then it's a different story altogether. So that's where we focused our attention to make sure that in our due diligence work we get a fair allocation. So we've got a fighting chance of doing something about it now. We've got some local control, but it will take a little bit of time. And the commercial realities around private NHS dentistry are a real challenge to overcome.
Thank you. So any other comments, questions? Yes.
Just when you develop the action plans, considering the role of the voluntary sector in actually delivering some of those and the resources available for them to be able to help act against some of the action plans, does need to be considered. But I'm sure it's already on your page, but we have a strong voluntary sector, ready, willing and able to help. I think they just need to be clear on what the ask is of them. So yeah, just as you develop the action plans, their role in the delivery being considered.
Yeah, absolutely. And I was hoping that kind of came through quite strongly in the report. I think they need to be at the heart of this and almost as an equal partner, I think is probably the term we use, Steve. So I know that, see, Christina, work that we're starting around a community paradigm, we've referenced that within the report as well, but actually I think that is understanding that relationship, isn't it? How we work with the voluntary sector, how we have a financially secure voluntary community sector. So I completely agree with you. And I think we probably need to work through how those individual partnerships that are tasked with delivering our priorities work with the community voluntary sector and the approach being developed. I don't know if you wanted to add anything, Christina.
No, that covers it.
Okay. Thank you. Thanks, Steve. Yeah. Okay. So the recommendation is first that the Health and Wellbeing Board endorse the Herefordshire Joint Local Health and Wellbeing Strategy. Second, that the development of an action plan is delegated to the One Herefordshire Partnership and associated partnership groups to oversee, with a view to bringing the action plan back for agreement. And thirdly, the board notes the alignment with the ICS strategy in terms of the board ambitions and partnership approach to delivery. So if I could have a show of hands of the voting members, all those in favour, thank you. So unanimous, I think, thank you. So I move on then to the next item, which is the sexual violence strategy, and to note the sexual violence strategy and contribute to its delivery. That is Francis, I think. You
yeah, we are hoping to be joined by Dr. Frances Howie. So she might not be with us yet, but I have a message to her, so I'm hoping she could join. So you might want to maybe move on to the next agenda item, if that's okay, Chair. And,
yeah, that's David, that's probably over to you. It's the
Okay.
Herefordshire Worcestershire Integrated Care System update on the ICS, and this is Francis joining us. Was that Francis?
Yes, it is, Chair.
Okay. Sorry, David, I'll give you. We'll take Francis.
Okay, that's fine.
Good afternoon, Francis. We can't hear you at the moment. We're going to get good at lip reading, aren't we, by the end of this?
I've got some connectivity issues. Is that okay now?
Yeah, we can hear you fine, yes.
Great, perfect, thank you. Sorry, because I've had to join part way because I was in another meeting. Is it now my agenda item, and do you want me to go through some slides and introduce the report on sexual violence?
Yes, please, Francis, yes.
Right.
We can give you a quarter of an hour if you would prefer.
Okay,
Which would you prefer? You can start straight.
I'll just go through these slides. I'll just introduce it and then throw it open to any discussion.
Okay, fine. Okay. Yeah, okay.
So I've assumed that people have had a look at it. So just to be clear that I'm here as a representative, or I'm here as requested by the CSP, the Community Safety Partnership, whose report this is. So Councillor Angela Tyler chairs that partnership. We took the report to there on the 10th of March, and she wanted it to come to the Health and Wellbeing Board. So that's kind of what we're doing here. And it has been a report that's been a little time in the making, and that's been good because we have all worked together. Various partners have worked together really well, the statutory partners to the CSP itself. So we've had the police, as you would expect, probation, NHS, particularly safeguarding, those sorts of partners. We've also had, as very active members of the group, Herefordshire Women's Equality Group, which has been extremely good. So we've really valued their experience. And we've also had RASAC, who are from the Specialist Sexual Assault and Rape Services, and we've also had West Mercia Women's Aid. So it's been fantastic to have a number of different partners, both statutory and non-statutory. We've now got this really clear consensus on the strategy, and it's to be a 5-year strategy, taking us to 2028. We've got an action plan. The action plan itself is now in dynamic mode. So we are taking it around and chasing the various action owners, working together in order to make sure that we have some really firmed up actions that make sense to everybody. You will all know the background in terms of sexual violence, but just to repeat it, this is sexual violence. It is, by and large, a crime or an activity that is perpetrated by men on women. So 98% of people who report sexual violence report the perpetrators are male, and it is an underreported crime in terms of it going in through the criminal justice system. But I think we're probably all pretty familiar with the reasons for that. And obviously one of the ambitions will be to make reporting a less traumatic process. We're also aware in terms of data that there has been a rise in reported offences, and that those are still higher post-COVID than they were in that period pre-COVID. We do know that there is evidence about what works, so we know what survivor services work. We also know more about work needs to be done with perpetrators in order to change perpetrator behaviour. And I always feel this is an important balance, because I think of perpetrators a bit as the sort of, it's contagious. We can sort of, after the event, act with survivors and the criminal justice system, but men come out of prison, men's non-molestation orders come to an end, and unless the work's been done with perpetrators to change their offending behaviour, they will simply go into new relationships. And we are conscious that the Commission services have got some capacity restrictions, and we are operating in an environment where we have some waiting lists for what really should be seen as urgent services. So we agreed on this common vision where everyone lives free of the fear, threat or experience of sexual violence. And we've got our 3 priority areas: prioritising prevention, supporting victims and survivors, and pursuing perpetrators. We worked quite hard on these commitments and principles, our approaches, which are in slides 7 and onwards, for a few slides there. Working together being really important. Increasing community awareness being really, really important. Challenging victim blaming language, challenging victim blaming behaviours, believing survivors, and challenging attitudes that lead to sexual violence, whether that's in schools or whether that's in workplaces. I was just in another meeting where we were talking about workplaces and how we might work across the county on that. So those were really important, and also understanding that support for survivors may well be lifelong. You know, this isn't this isn't like mending the broken arm. You know, it's kind of a lifelong system of care that is needed. So coordination really, really important. And also committed then to providing perpetrator programs. So those last few slides are just some of the actions underneath each of those headings of prioritising prevention, supporting survivors and pursuing perpetrators. A lot of that pursuit activity is taking place obviously in the criminal justice system, but also in the perpetrator space is doing some work with perpetrators to prevent reoffending. So our next steps are actively managing the action plan, which is the work that's currently in place. The subgroup is now moving to a quarterly basis, having been more often to get this consensus. And we remain committed to the vision that everyone lives free of the fear, threat or experience of sexual violence. And what the board is being asked to do today is to read it. You know, everybody agrees with it. What the board is being asked to do is to sort of hold the mirror up and say, so in my organisation, what am I going to do differently around this? The fact that we have now got this policy signed up by the CSP, and the big ask, I guess, is that people actively engage with an event which will take place probably in the autumn, that people consider signing up as white ribbon organisations, and that they will be able to say in a year's time that this is something which is more visible within their own organisation than it was today. So that's my bit. So happy to take any questions or any contribution that you might want, Chair.
Thank you. So any questions, comments, observations from the room? Not so far. Any remote?
I have it.
Yeah, fine. Diana.
Yeah, thank you, Francis. It's really good to have that all brought together, and I'm really glad that we've worked with those important partners, RASAC and Women's Aid and the Women's Equality Group. As you say, it's really worrying that sexual violence is so underreported. The conviction rates are absolutely appalling, absolutely scandalous, and given what we're learning about the police now, you know, that's another reason. There are lots of reasons why people might not report, and given what we're learning about the police now, that's yet another one. We can't be sure that every member of the police force is actually even going to take sexual violence seriously. So, you know, I trust that the subgroup is also going to bear that in mind and look at the reports that are coming out and keep holding our police colleagues, most of whom are doing a wonderful job, to account, because it is very worrying, some of the stuff that we're hearing. It's good if we can have a really clear offer to schools. It's so fragmented what goes on in schools, this programme and that programme. So it's really good if we can have that really clearly set out, isn't it? So that we know what we're offering schools in the way of training around consent and all that, boys' behaviour and all that kind of stuff. And the appalling influence of porn, and you know, really set out clearly what we're offering and persuade them to take it out, which is difficult because we have limited influence over schools. And also, yeah, waiting lists, the thing that jumps out at me in so many of these things, you know, and we all know what we need to do, we know what works, we know what the data is, etc., etc. And people waiting, whether it's for the dentist or for, you know, counselling after sexual violence, that's really worrying, the waiting list. So let's focus on, you know, which roles we need to fill, what resources we need to be able to do what we need to do. Thanks very much.
Thank you. Yeah, Francis, sorry, Matt, yeah.
So thanks, Chair. Francis, just want to say thanks to you and the group for taking this strategy forward. I think it's really important. I just wanted to bring attention to the board that within our new strategy under mental health, we have one of the outcomes is people feel safe from harm in their community. So that's very much where we see this strategy sitting within the wider health wellbeing strategy. So I just wanted to make your attention to that. But thanks for a really good strategy, really important. Like Councillor Toynbee said, it's underreported. So we really need to kind of take action and work together. And another whole system approach needed for this. And on your point about schools, Councillor Toynbee, I think there is something, I think we talked about it this morning, a whole schools approach, whether it's food, physical activity, sexual violence, all these things need to kind of come together somehow in how we support schools in driving this, in addition to obviously their education priorities. So, okay.
Yeah, Francis, I was pleased to see that the first priority area is prevention. I mean, in a lot of things we're doing, we're saying, let's stop it happening, and then when it has happened, then we take separate action. But it's a huge issue, isn't it? I looked at the first aim was to increase awareness and understanding of sexual violence and its drivers amongst professionals and the community. And I mean, that's a national issue. It's not just about Herefordshire, but if we can change people's attitudes. And for me, I mean, it is a largely a male issue, and unfortunately, children model themselves on their parents. And so if the parents think a certain kind of behaviour is okay, then the children think it's okay. And so it's so embedded that I think it's a really difficult, it's a long-term issue. I'm sure you agree with the complexity and difficulty of communicating that.
Yeah. Did you just want me to respond to that?
Yes, yeah.
Sorry, just it's like when you're being remote, you can't quite tell if anybody else has got their hand up. Yeah, huge issue. I think something that's worth sort of taking away is the point about corporate social responsibility. So what we've got here is we've got a group of people who are really influential in anchor institutions. So if part of the social value that these anchor institutions adds is higher visibility around sexual violence amongst their workforce, that would be great, because I think we've seen numbers before, about how many employees, if each of those employees lives in a family of 5 or 6, that influence is really very significant. So I think it's incumbent on us to think, so what is the call to action on that? What's the call to arms? We want managers to be aware of some of the signs of, say, anger management amongst their staff. Are they comfortable with raising with male staff who appear to have anger management issues about what they're going to do about that, where they're going to refer them, those sorts of things. So I think we have to sort of find something that we can do in our local place, whether that's perhaps rolling out the bystander training, rolling out some very powerful videos about how to get involved with things that you see happening around you, and that's our staff as citizens of this county. And then there's the corporate stuff that makes that happen. I think that we can be positive that frankly it's not being taken seriously because it hasn't been taken seriously. And I also think something work this group has done that's been really helpful is to get really clear on language. So sometimes we just get afraid of saying the wrong thing. So we've worked really hard together on getting the right language, which is the language in that strategy. So it's moving to survivors, not victims, unless they happen to be dead, in which case they are victims, but trying to understand the survivors and how we support that survivor journey going forward. So, and understanding the vulnerability of our perpetrators who have so often had very difficult childhoods, for which we often are responsible for mitigating the risk that having ACEs in childhood presents to women in adulthood when those children experiencing ACEs are males. That all makes sense. On the police point that was raised with Councillor Toynbee, I just wanted to say that we have already started to understand how the Maggie Blythe report goes into the action plan and some of those recommendations. We've already had an additional member from the police who joined the group last time, who's DI from the from HQ, DI from the Vulnerability Unit, which is great, in addition to Ross Jones as being the local police representative on that group. So we've got really strong representation from the police.
Yeah, in your introductory comments, Francis, you were saying that this was for each organisation to take away and see what they can do about it. And I must confess, when I was reading it, I was thinking of what the council's responsibility was, and in the context of this particular one, we've got the action owner being the council, but then the action partners being RASAC, Women's Aid, and Herefordshire Women's Equality Group. So, but there's no sort of group which is represented here, and I think you're looking for this document not just to be council related, but actually to apply to the whole county, which I think is a little bit of the point that you're making there. So another point I'd like to make on the third, priority area 2, supporting victims and survivors. Point 5, it talks about ensuring that where sexual violence happens between children, that steps are taken to support and protect the victim, survivor, the person accused of harmful sexual behaviour, and others within the group. And the action, and I was pleased to see that in the context of our own issues with peer-on-peer and whether we're doing enough. But your action is conducting an audit of processes currently in place in schools to understand what is being implemented. How quickly do you think that can be done? Because I know it's a continuing concern for some councillors as to what we can do. And in the last column, it talks about guidance and training is delivered. So sort of a measure of success, guidance and training is delivered and implemented in Herefordshire educational settings. There is already a lot of guidance and a lot of training going on. So I just wonder how quickly we might wrap up that particular one, or is that not quite as easy? It's ongoing and changing, but peer-on-peer reviews is really significant as an issue. From an early age, children are affected then for the rest of their lives.
Yeah, I mean, I'm very conscious that the director with this portfolio is in the room, although I can't see him at the moment, but I think he's somewhere. So I don't want to answer on his behalf, and I don't want to give an answer. I can't give a date. What I can say is that the sexual violence subgroup is working now to put dates against these actions, against this action plan. And child-on-child sexual abuse is very definitely something that is a priority for the group, and we are aware of the growing levels of challenge around it. So, that definitely is something that will have dates against it sooner rather than later. In terms of the training offers in education settings, something that's to note about that is that some of the funding for that comes down through the criminal justice routes, through the Safer Streets funding. And so that has been very good to see that there has been an additional offer in schools in the last year, and a way has just been found to extend that into this current financial year. So we do have an enhanced offer of Purple Leaf, which is one of the delivery organisations that sit underneath RASAC, going in. So that's good.
Yeah, thank you for mentioning that, Francis. I saw Purple Leaf there, and I thought, well, why isn't RASAC involved? But you're saying they are almost part of the same organisation, and that's really helpful, I think, Francis. Thank you. Anybody? David, you've got your eyes. No.
Nothing from me. Thank you.
No. Anybody else? I think the police one is an interesting one about I was going to say enforcement and getting more cases before the courts. But again, that's a national issue, isn't it? And the number of instances of rape and then it doesn't end up in court is just absolutely huge. And there are all sorts of reasons for that. And I think we're not necessarily looking to change that ourselves, but I think there's reference to ensuring that any changes are circulated widely, and changing the law ourselves. And doing that, we use whatever central government sends down to us. Francis, I don't know whether you want to comment on that.
Yes, I mean, you will be well aware, obviously, about the changed tone of the national debate, really, both in terms of some high-profile cases of offending serving police staff, and also in terms of the Maggie Blythe report, which has sort of highlighted it. And I guess there is nothing that's happening nationally that stops us from doing everything we can in Herefordshire. And I think it is worth saying, and I'm not sure if there's anybody from the police on the call, so spare their blushes if they are, but I think it is worth reporting here that I have heard nothing other than respect and concern from the police that have been involved thus far. You know, there have been people who are engaged, who are sending additional staff, who send substitutes if they happen to be on leave. You know, this is a matter of serious concern for our local police force. And I think we've been involved in individual cases where we've seen that. And something that struck me from some of the national coverage was this ridiculous thing about people having nicknames that made it quite clear that they had patterns of really bad behaviour towards women. I personally have seen no evidence of that in the police that we've been dealing with thus far, who are senior officers who are leading the way in trying to bring improvements locally.
Francis, thank you. Helen is actually on the screen, but she is quite, oh no, yeah, there we go. Helen, I don't know whether you wanted to comment on that at all.
Yeah, apologies. At an entirely inopportune moment, I'm on call and I had to step out. So unfortunately, I've missed the bulk of what Francis has said and the question. So I apologise. So just to say, I'm really pleased to hear that's your perspective, Francis, in terms of the engagement that you've had with our staff here. You know, we work really hard to prevent this type of offending, and when it does happen, to do everything that we can to bring offenders to justice. So it's good to see that you pick up on that perspective from our staff. And I apologise that I had to step out during the bit that probably is the most relevant to policing. So I apologise.
It's fine, Helen. Okay. Now for this item, I don't think there's a recommendation, is there, Francis? It's just for noting.
It's just to note and to commit to action, so that will mean that people should make sure when we have an event, we'll make sure that the members of this board are circulated and that there is representation from their organisation with dedicated time to attend to a day. Yeah.
That'd be great. So I've been pointed to the recommendations, which is the board notes the strategy and supports the board to facilitate further development. The screen's gone blank. Development and delivery of the action plan. So yeah, Christine, you proposed that. Thank you. All those in favour, voting members, thank you very much. Okay, thank you, Francis.
Thank you, Chair.
Important stuff. Thank you. So we move on then to David. You've been warmed up.
Yeah, second start for the day.
Yeah.
I think we're probably heading for an early finish, to be honest, because I certainly don't intend to take 2 hours on this session. People will be pleased to hear.
Thank goodness for that.
It is just a brief update on the integrated care strategy and the joint forward plan. So the ICP met yesterday. There were are people around the table who were at the meeting. It was a very good meeting, very good conversation, and I'm pleased to report that the ICP approved the integrated care strategy for publication, with some very, very minor amendments to be made. We will not publish until after the elections, in accordance with kind of NHS guidance around putting stuff into the public domain during that period of time. I'd like to kind of just reinforce Matt's point earlier about the strong alignment between the two strategies, so the system-wide strategy around integrated care and the health and wellbeing strategy. It's great to have a common vision. Priority areas are very closely aligned as well, so there's a best start in life priority in the integrated care strategy, and mental health and wellbeing runs through all of the priorities in the integrated care strategy. So we've got best start to life, living, aging and dying well, and then preventing ill health and premature death from avoidable causes, and mental health runs through all of those. So mental health in children, mental health in adults, and preventing suicides as well. So that's a strong link for us as well. And it was great to see and to be witness to the ICP conversation yesterday on mental health, the new collaborative, really bringing it to life, and particularly the stuff around the relationship with the voluntary sector and the way in which we've kind of changed our way of commissioning to try and move away from a kind of a purely medical model. And I think it was the thing that who was it that said that I think the Jack that said the NHS focuses on kind of diagnosis and risk, and the voluntary sector focuses on need and support. It was that kind of. It's quite a kind of stark statement to make. It's pretty obvious, isn't it? Because we're back to the kind of prevention and not trying to medicalise issues that perhaps are better solved without having a medical solution to them. So that was good. Just moving on to the joint forward plan. So this thing, the joint forward plan, it's the document that the NHS bodies So the 3 NHS trusts, the ICB and the 2 primary care families that operate across our ICS area are working together on to produce, which will be the NHS's response to the integrated care strategy. So how will we as NHS partners take the actions and implement the changes that we need to do to make our contribution to delivering that strategy, and alongside that, delivering the health and wellbeing strategy. So the report provides a little bit more detail on the content of the joint forward plan. Apologies for the small typeface, if people couldn't see it, but it was just a plan on a page and quite difficult to squeeze into a portrait document rather than the landscape. But as I say, it's about the focus of core NHS services and the contribution it will make. So the Health and Wellbeing Board will be asked to consider that document at the development workshop on the 24th of May. The whole of the Health and Wellbeing Board development session is dedicated to going through the joint forward plan. We're aiming to have what we call a substantially complete document by the 19th of May, so that's the Friday before. So apologies, we won't be able to get the document kind of a week before to Health and Wellbeing Board members, but as it's a development session, I'm hoping that's not too problematic. And we will share that document when it's substantially complete as quickly as possible directly with Health and Wellbeing Board members. And the specific request of the Health and Wellbeing Board on the 24th of May will be to form an opinion on the extent to which the joint forward plan addresses the priorities set out in the health and wellbeing strategy. So it's not a kind of an overarching review of the strategy and whether you like it or not. It's specifically, do the actions that the NHS are planning to take address the priorities that we collectively kind of agreed to today in the health and wellbeing strategy. And then we need to then write that opinion up collectively as a health and wellbeing board and then publish it in the document that will be ultimately published on the 30th of June. The JFP will be marked by NHS England, reviewed by NHS England as a part of an assurance process as well, which is fairly typical in the way in which the NHS strategies and plans are developed. So that's it. That was the update I wanted to share today. I've got nothing more to add, Chair.
Okay. Thank you, David. Any questions? Magnifying glasses provided next time? I did expand it on when I saw it on screen.
You can see it.
Yes. And I kind of looked at the priorities and I thought, so in the middle bit, it goes to item 5 before it goes to a more traditional NHS, as I see it. You know, urgent and emergency care comes in number 5, but before that we've got maternity service, early years, learning disability, mental health, those things coming first before we actually get to that.
That's absolutely to try and reflect in both counties, mental health and wellbeing has been is a high priority, and clearly the early years agenda in Herefordshire and across the ICB is a high priority, so it's very much to reflect that prioritisation of effort.
And maybe I missed it because of the timing, but it doesn't seem to talk about waiting lists and service by a particular time. Is that the next level of detail?
It will be
yeah. We will have to have that sort of thing.
Yeah, we've got very specific trajectories that we've achieved to. So up till this March, it was removing 2-year waits. Sorry, now I correct that. 78-week waits up till this March. It was 2-year waits. Previous to that, and for next year we've got to eliminate 65-week waits, and that's the kind of, so we're really trying to tackle the long end of the tail of people waiting a long period of time. And I mean, we've gone from a position where we used to measure waits over 18 weeks and our performance against 18-week waits. We went into the pandemic and that just completely reset the whole agenda for us. And yeah, 1-year waits, 52-week waits were unheard of prior to the pandemic.
Yeah.
Very small numbers, but now, you know, to talk about 2-year waits was horrendous really for us. So we're pleased to have eradicated those, all but for a very small number of complex corneal transplants, which Matt, you probably know more about than me from a public health perspective, but you've got to wait for the transplant and the for that operation to take place. So it's not really one that you can influence the time on. All of the others have been eradicated, and we're now moving on to that next phase of bringing down 78, 65-week waits, with an aim, obviously, to get back to 18 weeks at some point in the future.
Yes, I'm not quite sure how to balance those specific objectives against as a county and or several organisations trying to work together, how to measure, how long term, whether early intervention is working. It's going to be years to the date before we know whether early intervention helps, and how to measure, how to see that. After 1 year, what changes might we see, or after 3 years.
I mean, again, Matt and Francis and other public health specialists will be able to comment better than I can, but there are some early interventions and some preventative work that yield results very quickly, and we need to get that balance right. So we can't just focus on the things that will be multi-generational impact. Reducing smoking, particularly in pregnancy, for example, can have a very quick benefit around that. So we've got to keep that focus on things that will have a quick impact, but without losing the longer term benefit as well.
Diana?
Yeah, you mentioned NHS England, so it seems to me that the government sort of pushes a lot of responsibility, more and more responsibility down locally without the resources to go with it. But what's the relationship between? So we've got the ICB, we've got NHS England, and we've got the Department of Health. So how does the accountability work?
Gosh, that's so, I mean, the Department of Health is obviously the government department that allocates resource to NHS England, and then NHS England allocates the vast majority of its resource to the 42 integrated care boards up and down the country, but retains some services itself for things that are best managed on a national scale. So there are some very, very complex surgeries that are managed on a national scale, military health, things like that. In the old way of working, CCGs didn't have as wide a portfolio as ICBs have now. So a lot of specialised services were done regionally: pharmacy, dentistry, optometry, vaccinations and immunisations. They were all done regionally. And the CCG just used to focus on urgent care, planned care. It didn't even have primary care in the early days. More and more of that is passing down now. So accountability locally is, for NHS services, is the Integrated Care Board and the elected members. You mentioned Krishni earlier before we started. She's the chair of that board. We then have an accountability to NHS England, the region, Midlands region, who in turn are held accountable by the national NHS for their regional performance. And then obviously the Secretary of State holds the NHS England Chief Executive to account through the NHS mandate. So it's quite a complex infrastructure that we work within, but I think we're reasonably clear on where the accountabilities lie and what we need to focus on locally.
Thanks.
Any other questions? David, it's grateful for you to come in person to this meeting. I think it sends a very positive message to the county that we do count. These remote meetings are all very well, but it's nice that you take the time to come in person. Yeah. Okay, shall I move on then? I'm afraid this meeting is going to be terribly short. Have you got the recommendations there?
No, it's simply that the board considers the report.
Yep, so the board has considered the report, makes no particular recommendations, just noted. Thank you very much. All those in favour? Aye. Thank you. So item 11 is the future, the work programme 23-24. I don't propose to spend very much time on this. If anybody's got any thoughts, I think it's for the chair and deputy chair to work out some priorities for it rather than for me. But I think the next couple of meetings are all set out, aren't they, Matthew? And then after that, maybe there are things that will come in. So I don't want to start the conversation, but this is an opportunity for the board to review and populate the work programme. Does anybody have any proposals? I see none on the screen. I see none in the room. So we'll leave that one. Date of next meeting, 26th of June, middle of the summer, 4 till 3. Well, we'll look forward to that next meeting. Thank you very much. I will close. I think I can properly close the meeting.
Yes.
John, and thank you all very much for attending in person. And thank you for those remotely as well. You can go back